for your leadership. The hospitals have been conferring with the governor for several weeks about what interventional measures could be taken. We have long felt that a mandatory mask mandate was the absolute foundation of any public health address of the problem. So thank you, Governor, for your order. The other legs of that stool we have felt are population level testing, which is going to be rolled out under your program at universities and in some degree in high schools. And then the other thing was a social pause where we stick to contacts among our household and avoid all other social contacts and other contacts as far as possible. Of course, the question always is, the gun is pointed at the hospitals and particularly the ICU capacity. Hospitals operate under three different standards. The first one is normal care, where anybody can walk in and get care for whatever. The next one is contingency care. We've been in contingency care for a few weeks now, and by that I mean that we have expanded every possible resource. We have enlisted every nurse, doctor, and technician who's expert in treating this. We've created temporary ICU beds. We've opened beds in an orthopedic hospital in Intermountain's case. We are load leveling, meaning that we're transferring among hospitals. So Intermountain is transferring to LDS cases that could be treated there and to other facilities. And then we're also load leveling among systems, and that really started last week. So the big news is that we stood up our transfer center among systems, about 10, we've been operating it, but we in earnest began transferring patients about 10 days ago, and we've had 13 patients transferred, and that is that meaning that if an ambulance is on the way to hospital A and they're full, then they will divert that patient to another hospital who has capacity. So we watch the hospital capacity daily, and then we make those transfers. So that's not an ordinary procedure. So that's an extreme contingency measure, hoping to load level before we overspill every hospital's capacity. The other thing that we need to mention is that hospitals are adding additional teams. They've added every possible team they can. The University of Utah has added 2 or 3 teams. So where does that leave us? Hospitals report to us not just a numerical number on bed usage, but on the general capacity. In other words, how are they handling the load now? Because they may not get nurses showing up. They may have people out ill. They just don't have skilled crews, and that's not uncommon. ICUs typically operate on an 85% capacity. That's full for them because just changing patients, requirements for PPE and doctors, and just the churn, it's hard to get above 85%. We're above that now. Some hospitals effectively are at 100%. These are our referral center hospitals. We have some capacity. We're still treating all comers, but if we keep admitting 90 to 100 patients a day, then we just can't handle that, certainly in the ICU. Now, if you were to be denied an ICU bed, would you get care? Absolutely. We have still a lot of room in our general wards, in our med surge, and in our even in our acute care. But in our intensive care units, we're right on that line where we're effectively full. Thank you, Governor. I'll hang around for questions.
All right.